Hello, this is Friday, September 18th, and this will be the podcast number 9. Count them, 3 websites that you should really know about and the background information on them. Okay, I'll record. I'm starting to record now. I wasn't recording before.
I'm going to stop the video now,
Stop.
and I'll put you guys on mute.
All right.
Okay. All right, so I'm gonna start pretty soon. So what I wanted to do on this one is to basically talk about 3 websites that I think beginning students should look at, and then I went into a little bit of some background, and so I'm hoping that it works okay. Before I start, does anyone want to say anything or make comments or?
I don't think so. I don't have anything in mind right now.
All right, but then we can do some questions a little bit afterwards.
Yes.
Okay. Okay. So do you guys see, am I sharing my screen? Is it shared?
Not yet.
Okay.
There you go.
Okay, but I was going to stop.
Oh, he went back.
I went back, yeah. Okay. God, I'm like losing it. Okay. Okay. I'm going to share screen. And then I'm going to present. Okay.
All right. I'm going mute.
And then I gotta, okay, so you're going mute. Okay. Hello, good evening. This is the SFPDASC. We are an affiliate program of the West Coast Chapter Parenteral Drug Association, connecting people, science, and regulation. This is podcast number 9 of our weekly podcast, titled 3 websites that you should have in your favorites. These are websites that work for starting out in some background information about the PDA. As usual, this is with Nick Kapp, the SFPDASC academic advisor. Maria D'Aguilar is the president and editor of this particular program. Special guests include the PDA website, the WCC PDA ASC website, Innovate Bio website, and the Indeed website. Plus, as always, we have a live audience here who may chime in at any time. What we intend to do is to inform and educate a new generation of pharma manufacturers through a discussion of helpful links, stories, and interviews. Help us help you. In the coming weeks, we will be trying out various ways to inform our listeners to what it takes to work in the pharma manufacturing field. So you can email me always at kapp@smccd.edu. So I want to try and do something different for this web class. In this podcast, we're going to take a look at 3 websites that you should have on your favorites. Again, I want you to join the PDA, and we're going to be looking at the SFPDA ASC. I want you to look at what we call the Innovate Bio website, which is this link down here. And then we're going to look at Indeed. Before I go on there, if we had sponsors, it would look at a page very much like this. And so did you know that September 23rd or September 22nd, I don't know, is Temperature Control Day. And so the fall equinox is on September 22nd this year. And that means that the nights are equal to the lengths in day. And so what's happening is we are going from the fall to the winter. And so things that you need to do is to get a fall drink. And so get some cider, go to Starbucks and get your pumpkin latte. It's pumpkin latte or it's pumpkin spice, anything this coming season. You want to check your home heating system, and that's an OQ, an operational qualification that you want to do. And then lastly, shop for your fall fashions. So again, if we had a sponsor, this is where I'd put that information. So again, what you should have on your favorites when you're looking at websites is basically Indeed.com. And so when I click on Indeed.com, I'm kind of registered for this, and it's a way of looking at jobs that are in the Bay Area, in my area. And so if we take a look at these jobs, we see there's a lot of jobs out there in quality control and in biotech and in FDA compliance. If you believe this, indeed, FDA compliance, there's 12,000 new jobs. I don't think that's just in the Bay Area. I think that's all over. But as you can see, there's lots of jobs there. And so individuals who are members of the PDA, one of the things that we do talk about is that kind of FDA compliance. And I'll talk about that in a little bit. Again, what I like about the Indeed is it gives you some suggested research. It also evaluates what your potential employers would be. So again, pull this up and take a look at Indeed. Now the PDA as a group is over 70 years old. And so the PDA played an influential role in many of the most important advances in the manufacturing and the control of the parenteral products over the last 70 years. So again, it's been a big deal. And in the 1970s, they introduced standard methods for steam sterilization. That is, how do we get rid of contaminating microbes that are in a material? And this is due to a technical report number 1, which was done in 1989. Since then, there have been over. Sorry about that.
Thank you so much for that and for being here.
Oh my God. What happened? Okay.
That's okay. I can edit it.
Yeah. Okay. Let me breathe a little bit. I'm going to stop share. Maria, thank you. I'm going to share right now. And where'd it go? All right. So I got to get. So this is something else I was saving. Stop share. Oh, man. Well, we'll talk about it later. I heard people have been having a disastrous week this week. And okay. All right, so I'm gonna let me pull you guys up. Okay, so let's start. So the PDA is over 70 years old now, and the PDA played an influential role in many of the important advances in the manufacturing and control of parenteral products over the last 70 years. Okay, so they've been a big deal on it. In the 1970s, they introduced standardized methods for steam sterilization techniques with the publication of the technical report number 1 in 1979. Since then, there have been over 80 additional technical reports published by the PDA. They have a full-scale clean room for use of hands-on training. The PDA remains a leader in sterilization, aseptic processing science, and many other areas of the pharmaceutical manufacturing and control. And so what's parenteral drugs? And so parenteral drugs are sterile preparations containing one or more active ingredients that are intended to be administered to a patient in an area other than the alimentary canal or salivary on the skin. And so for the most part, they are injected underneath the skin. They can either go into the muscle or the fat or a number of these other different routes. that gives us some special necessities because they are going directly into the body. And if any of you have taken an immunology class, you know that your skin is there to protect you from invading microorganisms. So anything that goes past the skin has to be sterile, be pyrogen-free. And so a pyrogen is basically a chemical that's going to cause a fever. It's usually the lipopolysaccharide from E. coli. It has to be free from particulate matter. It should be clear. It should have stability. We don't want to worry about this thing kind of degrading or forming some other structures when we bring it out. And it should be have kind of human isotonicity. And that is, if you have things, if you just injected water or if you injected a very strong sugar solution or concentrated sugar solution, that would cause some pain in there. So it's very critical that those be adjusted to what is in human beings. So the solvents and vesicles must meet special purity and other standards. You have restrictions on buffers, stabilizers, and antimicrobial preservatives, and definitely you don't want any coloring agents. It must be prepared under aseptic conditions, and so that's one of the very critical things of that. Also, these drugs tend to have very specific and high quality packaging requirements. And so when we talk about a parenterals, we have small volume parenterals, which are basically anywhere from less than 1 mil to about 500 mils. And these are injected all at once. And these include things like furosemide. You may have all heard about heparin, iron, dextran, et cetera. Some of the large volume parentals were basically anything above 500 mils. And so these are injected or these are put in over a long rate of time. These include infusion fluids, total parenteral nutritional solutions. So again, if you have a patient who can't eat, you can feed them through a tube, dialysis fluid, et cetera. There's a whole bunch of things. But any of these that go in underneath the skin have certain characteristics. And so what kind of forms do we have in that drug? Again, you're going to have sterile solutions. So here's something like an IV bag. If you look at it, this has a blue dye in it. We would not be able to definitely use that. Prepackaged syringe is a big one now. And so what we're doing is what a lot of companies are doing is they are prepackaging the material to be injected directly into syringes at the factory. And so when the doctor's office get it, they just need to kind of open up a package and they can set the injection. We also have vials. Oh, sorry.
It's not sharing. I just realized that it's not sharing.
Okay.
Yeah, I only see your face and my face.
I only see your face and my face. Okay. Thank you. So let's do. God, I'm having troubles today. So sharing the screen. Okay.
Yes.
All right. So I think where we were at is this one here. PDA is over 70 years old. Okay.
Yes.
All right. Thank you for letting me know. So
No
this is
problem.
take number 3. And I'll click on the presenting. Okay. So the second website that you should really look at is the PDA website, pda.org. The PDA is now over 70 years old. The PDA played an influential role in many of our most important advances in manufacturing of sterile materials. In the 1970s, they introduced standardized method for steam sterilization techniques with the publication of Technical Report number 1 in 1979. Since then, over 80 additional technical reports have been published. They have a full-scale clean room for use in hands-on training, relatively inexpensive for members, and they also remained a leader in sterilization, aseptic processing science, and many others of pharmaceutical manufacturing and control. And we'll talk about that a little bit later. So what is a parenteral drug? A parenteral drug are basically sterile preparations that are meant to be injected underneath the skin. And so I have a picture here. We have a number of needles, and it shows kind of where those drugs are going. Those drugs, because again, they are going underneath the skin and they're going directly into the systemic system of the body, need to be sterile. Because again, if you remember from your immunology or your microbiology course, Your skin is one of the major barriers to outside infection into the body, and that the inside of the body should be relatively bacterial or pathogen or microorganism free. And so anything that you introduce by injecting it into there can be a very problem for the body. So that being said, any of the drugs that are prepared must be sterile. They also must be pyrogen free. So a pyrogen is basically a chemical that actually causes fevers within the body. And so they're not necessarily infectious, but they will make you feel sick, or they will make you give a fever. And so there's a number of different ways that we need to treat this material. So even though it's sterile, if it has a pyrogen, a patient will react to it. These preparations must be free from particulate matter. They must be clear. They must be stable so that you can store them and ship them, and the patient will take them, and there's still that particular item. And then they must be isotonic to the human body. And again, things that are have lower concentration or higher concentration, the patients would be able to know that. They tend to complain about it. Solvents or vehicles used must meet special purity and other standards. You can't just use tap water for it. We have something that's called WIFI, water for injection. It's very highly purified water. There's restrictions on the buffers, the stabilizers, and antimicrobial preservatives that you should use. And definitely you don't use coloring agents. And so you may want your sodas to have color to look like cherry soda, but you don't want to be having that be delivered into your body. Again, these must be prepared under aseptic conditions, and there's specificity for high quality packaging. And so, again, when we look into parenterals, we can have small volumes, which is anywhere between 0.1 mil and 500 mils. And these include things like heparin that are being injected, kind of a one of. Sometimes you have large volume parenterals, which would be like your IV bags, your infusion fluids, total peritoneal nutrition solutions. And so, again, you can feed people not necessarily through the GI tract, but by having the materials go in. So when we take these parenteral drug solutions, these sterilized solutions can be packaged. And what I have here right underneath Priscilla, I have kind of an IV bag. If you look at this, this has a nice, pleasant blue color. But again, when you're injecting somebody with that, you don't want to have that dye. So this wouldn't be correct, having that dye in there. We also see prepackaged needles. And so that's one of the formulations that we tend to see a lot now, because that prevents mistakes from occurring. So what's happening is that at the drug company, you are prepackaging needles that are ready to go. And so all you need to do at the doctor's office is open up a package, pull out the correct injecting needle, inject the whole thing. We also see that powders that are reconstituted. So there's a little GIF here, and so we see a powder that's being reconstituted. Again, that's sterile, and what you would do is you would take some sterile water and reconstitute it to that with the needle. We would see powders, and then we would see lyophilized cake in order to do that as well. Again, the last thing I'm showing here is that vials, and so this is a classic example of what we've seen. So we have our active ingredient in the vials, and that can be cracked open, a single use, and you would go in there and fill up a syringe with it. And so the Peritoneal Drug Association is a global provider of science, technology, and regulatory information. So you need to know about regulation. If you're making a drug that's going to be injected, the PDA is one of the groups that you should probably be aware of. The purpose of the group is to create an awareness and understanding of the important issues facing the pharmaceutical and the biopharmaceutical community. They deliver high quality, relevant education to the industry. And so if you look at the PDA, actually they're an education organization. They're an information sharing organization. They develop scientifically sound, practical, technical information and expertise to advance pharmaceutical and biopharmaceutical manufacturing science and regulation. And so while it's not a college or a university, it's a group of professional individuals who are sharing their information. And so you can have this information in one company, but if it's just one company, then we feel that the industry overall is going to suffer. By having people share their best practices, we feel that the industry overall would do better, and we'd better serve our patients. Now, the next thing I'm going to talk about is what we call CGMPs. And usually this is so boring that at this point, everyone's kind of falling asleep on their desk. Hey, it's COVID, you're not falling asleep on your desk, you're falling asleep on your computer. And so what we see is that, remember, if we look at, when we looked at the Indeed website, that the need to manufacture under CGMP, that is FDA compliance, has lots and lots, they're looking for lots of jobs. And so, again, what you may want to see is I would like to work in the field. I would like to make a drug. I would like to help people by making drugs. What's one of the jobs that I can do? Again, looking at this FDA compliance is very important. It's not the most exciting, but it is very important. So what I want to do here is talk a little bit about what GMP, or good manufacturing practice, is. And so I'll read you the title, and please don't fall asleep like you saw before. But good manufacturing practices are the practices required in order to conform to the guidelines recommended by agencies that control the authorization and licensing of the manufacture and sale of food and beverages, cosmetics, pharmaceutical products, dietary supplements, and medical devices. These guidelines provide minimum requirements that a manufacturer must meet to assure that their products are consistently high in quality from batch to batch for their intended use. The rules that govern each industry may differ significantly. However, the main purpose of GMP is always to prevent harm from occurring to the end user. Additional tenets include ensuring that the end product is free from contamination, that it is consistent in its manufacture, and that its manufacturer has been well documented, that personnel are well trained, and that the product has been checked for quality before more than just at the end of the phase. GMP is typically ensured through effective use of a quality management system, a QMS. Okay. So again, why do we practice GMP, or these good manufacturing? And again, if we look at it here, and this chart over here is anywhere from scientists to food manufacturing, you're going to need to do these GMP processes. If we look at good manufacturing, we can see there's quality management involved. We need to make sure that we have suitable factories, that complaints and recalls are documented and handled right. We need to look at traceability, and we need to look at hygiene in their production. And so GMP refers to the current good manufacturing practice. This is the regulation that's enforced by the FDA. And so again, why do we have this is because consumers expect that each batch of medicine they will meet quality standards so that they will be safe and effective. But believe it or not, the FDA has not really tested batches since the 1980s, and I think even before that. And if you think about it, there's thousands of drug companies that are out there, and you just have the FDA, and it's a government-run organization, and the government wants to be leaner and leaner all the time. And so again, how do we ensure quality? What can you do to ensure quality when you're actually not going out there and testing those batches? And so again, here's a picture here. The FDA may used to have checked this, but they kind of don't do it anymore. But the FDA is responsible for checking sure and making sure that we have quality. Again, by using CGMPs, we provide a system that assures proper design, monitoring, and control of manufacturing processes and facilities. And it ensures the identity, the strength, the quality, and the purity of these drugs. In order to achieve CGMP, you will need to establish a very strong quality management system, attain appropriate quality raw materials, establish robust operating procedures, detect and investigate product quality deviations. And so what we see is CGMP is not law. CGMP is not testing, but the CGMP requirements are established to be flexible. So if you have a law, you absolutely have to do things to the letter of the law. But with CGMP, what you say is the law is you must follow CGMP. However, the CGMPs, each manufacturer, that is your company, decides individually how to best implement the necessary controls by using scientifically sound design, processing methods, and testing procedures. The C in CGMP stands for current, requiring companies to use technologies and systems that are up to date in order to comply with the regulations. How do they find these current requirements? Is they go to the PDA. And so again, what I'm saying here is the FDA's expectations. How are we supposed to know? How's a brand new company supposed to know what the expectations are from the FDA? So the FDA publishes regulations and guidance documents for industry in the Federal Register. You can go to the FDA website. It's www.fda.gov. This also contains links to CGMP regulations, to guidance documents, and to various resources to help drug companies comply with the law. The FDA also conducts extensive public outreach by presenting to professional groups like the PDA or the ASQ or the ISPE. And lastly, you can use consultants like me to go in there and help your company figure out how to use CGMP in order to manufacture your documents. The last thing that I'd like you to, a website that I'd like you to know, especially if you are a beginning practitioner of biotechnology and biomanufacturing, is the National Center for Biotech Education. This is a center that's called Innovate Bio. And like the PDA, they are an educational group. But again, they're a little bit kind of lower down the line. I think PDA is a little bit more towards regulation. The biotech is basically looking at how to train people to do procedures and to work in a lab and work in a manufacturing environment. And so the National Center for Biotech Innovation and Education, or this Innovate Bio, has links to centers that offer you a certificate or degree in your area. So they're a national center, you can look them up, and you can find hopefully a community college or another area down the street from you in the area that you live that can help you gain the knowledge and skills to get a job in biotech. They also have, again, in times of COVID, they have talks and get-togethers that usually are free. They carry career information and more blogs. So like this blog, they'll carry more blogs. They are funded by an NSF ATE grant, and so they have federal help behind it. Well, those are 3 websites that I think you should have: the Indeed, the PDA.org, and the Innovate Bio. So this has been KappsBlogg. Thank you for tuning in. See you later. That was a little bit longer. Hi, guys. Did I put you to sleep yet? That was a little bit longer, but we could edit some of that out.
Mm-hmm.
Hi.
Is that Tram? How'd it go, Tram? How'd you like it today, Tram?
Hi. Hello? Hello?
Hello?
Yeah, it's quite fast. Yeah, but I like it. A lot of info.
Okay, a lot of info. But, I think there was some of the beginning info that people need to know. So I think that was good. Priscilla, how about you? How'd you like today's talk? Is there anything?
It was good. Yeah. A little bit of intro on CGMP, which is also good to reinforce, to get engraved in people's heads.
But we're going to have talk. We're going to have Lee come, right? Maria, well, she may be on link, but we're going to have Lee. We're going to have some talks on people coming in and just talking about CGMP. But sometimes those can get kind of dry and people fall asleep during those. We'll have to see how he does.
A lot of people doesn't really know what parenteral means, so that's good that you explain what it is.
Yeah.
That too.
I always say peritoneal. Why is that? Peritoneal is harder to say than parenteral.
Say parenteral.
Parenteral. I'm a good parenteral.
Oh, God.
Yeah, like parents.
By the way, thanks Priscilla for leading. I called her yesterday and just told her
problem.
Well, thanks for taking time out of your vacation to.
No, we're putting makeup on and just getting ready before we head out again. So
okay,
it's cool. But I don't know if I have any other. Oh, so do you have the title for this?
Yeah, I think it was just like 3 websites. I thought I sent you the slides and the title earlier today. I'll have to check.
I see. Yeah. You did. You did.
Okay.
So no meeting on Monday.
Okay, good. It's good to have a break every once in a while.
What else is going on? So I was saying that, the WCC Zoom is not until the 29th. It's postponed because, so.
That's the 29th of this month, September 29th or October 29th?
Yeah. So you want to talk about what you want to talk about next Friday?
I've been trying to get a hold of Doug, and so we'll see about him coming and maybe talking a little bit about his program or whatever. I want to try and do it definitely in 5 minutes. No, in like 10 minutes.
I see.
And then Brian, he said he would do it with us a little bit later on in the fall. He
Right.
said he's kind of swamped now, and that's good. But he sent you an email back right away, so that's great.
We can email him on October.
Yeah.
To remind.
I've been liking the kind of the intrigue on the vaccine and stuff, like the vaccines and stuff. How about maybe talk about the cold train? So the logistics and cold train of getting the vaccine out by November 1st.
That's interesting.
Mm-hmm. Yeah, and why people are pushing it so much, even though that's not how it actually works.
So maybe we can do something like cold train, how to deliver 300 million doses of vaccine.
Mm-hmm.
Maybe.
That would be great if there's information out there for that.
I think there is. I've seen some. Could do it. Well, I mean, you just talk about it. So, like the Moderna stuff needs a -80 freezer. You could store it for 6 months at -80 in the freezer. You can store it for 1 week on dry ice. Actually, 1 month on dry ice, or you can have it in the fridge for a week. So that includes shipping.
Oh.
And I should be able to get some of that. Anyone else hear anything interesting? Maria, have you heard at all from Genentech?
I haven't heard from Parag. He's ignoring my email now. So yeah, it's tough, but I mean, maybe when I get back, I'll give him an email and just check back.
Yeah.
But yeah, I don't know.
So I'm going to be doing hopefully some biomanufacturing this semester. So like we did last semester, if people are interested in maybe coming in on a Friday and gowning up and maybe doing something.
Mm-hmm.
I have to look. I have money to hire a student, but none of you guys are students right now.
Yeah.
How about Priscilla and Tram?
Tram, are you taking any classes anywhere?
No, I don't.
Yeah, so they're just kind of working. So we'll see. We'll work on it.
Why does it have to be a student? Why can't it be just recently graduated?
We'll have to look. For the most part, for hiring someone, it's a lot easier to hire a student than it is to hire somebody, even if they're a recent graduate.
Mm-hmm.
So.
I'll go ahead and leave you guys. I will talk to you through email.
Okay.
Text me whenever you have any questions.
Okay.
Thanks, B. Bye, Tram.
No problem. Bye-bye, Maria.
Thanks, Cap.
Enjoy.
Okay, bye.
Bye-bye.
Well, Priscilla, Tram, do you have anything else do you wanna talk about or?
I don't think so. It's not.
Me neither.
Yeah.
Okay.
Yeah, just the job search is going slow,
Yeah.
but as usual, that's how it works.
Yeah. No, that's how it works. So that's okay. Tram, how's it look? Are you going to start up at Berkeley in the spring, or when are you going to start up at Berkeley?
Yeah, in the spring. I hope they will be open by then.
You never know.
Yeah, especially with this and depending on how people respond.
Mm.
Yeah, and it's cold and flu season coming up, so that may be a little bit more scary.
Yeah, a combination of everything.
Yeah.
Yeah.
All right, it's always good to talk to you guys, my PDA brothers.
Yeah.
All right.
I'm gonna get
Thank
going.
you.
It is so hot in my little room here. I'm sweating. So I'll talk to you later.
You need ice cream.
Okay.
Ooh, ice cream. Or I need those noodles. Thanks, Tram. I'm gonna try and go and do that tonight.
Yeah, that too.
Okay.
Right.
Have a good time there.
Bye, everybody.
Bye.
Thank you. Bye.